Hi, I'm Jim Farrell, Mayor of the City of Federal Way. And on behalf of the city, I'm honored to take this opportunity to express our gratitude to the folks here at Valley Cities. Your commitment to mental health and substance abuse treatment is an inspiration to everyone in our city. The work you do is so important. With nearly 600 employees and nearly 18,000 clients in 2023 alone, your impact on this community is profound. We're so glad you're here in Federal Way, and thank you for all you do every day.
I'm a very passionate person, and coming to Valley Cities is part of my mission.
I saw a need, and I'm retired military, and being in the military, you do deal with a lot of alcohol is really prevalent in the military, and so there was a lot of, when I retired and thought that I needed my next career, this just helping people just seemed like the obvious choice for me.
When you're in recovery, or when you're getting ready to go in recovery, you're vulnerable at a particular moment where you know you need to do something different. It's going to be doing this or I'm going to die. And when you make that decision to get treatment, get help, you have to take advantage of it as a provider. You have to admit them where they are.
Valley Cities helps our community so much in our focus in helping patients achieve their goals, achieve their own success, and focus on the recovery plans that can have long-lasting change in their lives.
Yeah, so Mental Health First Aid is an evidence-based one-day training program. It teaches people how to support those either in crisis or experiencing mental health or substance use issues. And last year in King County, we trained over 1,800 individuals in Mental Health First Aid.
I've been on the City Council for 13 years, and before that I was involved in the school district with PTA, and I was a school nurse. I worked with our medically fragile kids, and it's so important to have you guys in our schools helping our students, and we really appreciate the fact that you're doing that.
I get to, with clients, be able to see how they can go from thinking they're not able to work or don't think that they can do any type of employment or a certain type of employment goal. We can help them understand how to get to that goal and help them achieve it.
We are so lucky and fortunate and appreciative to have a clinic for Valley Cities right here in Federal Way. They're all throughout King County, but we are so proud to have a clinic here because to keep that business heart beating, we need strong minds as well.
You know, I'm a peer and I know what it's like to feel hopeless. And I always want to bring hope and give hope to other people. And I want them to know that they can have fun sober, they can have fun and live a very productive life with mental health.
I was impressed with the commitment of the staff to the clients. They treat the clients with such respect, and it's just so moving because people tend to marginalize behavioral health, especially on the inpatient side. And our staff always treated them as though they were human beings and they needed that assistance, they needed that hand.
So I know Mental Health First Aid is making a difference based on the feedback that we get from participants after each class. In one instance, we heard back from a participant who used the action plan to assist someone who's experiencing suicidal ideations. So they were able to de-escalate the situation and refer them to the appropriate support and actually ended the interaction on a positive note.
It's, you know, it's one thing to be a Walmart employee and it's another thing to be a servant to the community. And one of the things we pride ourselves in is really working to take what is happening in our community, what involves our associates, and get involved in it ourselves as a company.
Being clinic manager here and being able to still see clients allows me to work with an amazing team, support courageous clients, and make a positive impact for our community. It brings me so much joy and immense fulfillment every day. I don't think I'd want to be anywhere else. Valley Cities has been a huge part of my success as a clinician, as a person. Just being part of this community has been amazing.
To have those people, the other clinicians and care navigators that work with Valley Cities and the other people that go out of their way to show compassion, sometimes that's all people need.
What drew me to Valley Cities was just who Valley Cities is, building bridges and reaching out and helping people that have been marginalized for sometimes a very long time, and not only in one given service, but a multitude of services that become a package that people will be able to get help.
Valley Cities brings the respect and care that we all need. And I became a board member because my daughter said that it really helped her, and I wanted to give back. And when I got on the board, it's amazing. There is just a tremendous amount of care, and we really do want to be a destination place for services and staff.
When I first moved to Washington, I didn't have insurance, I didn't have anything. I just called Valley Cities, like the intake line, and asked if they could help me, and I came in, they got me signed up for insurance, they got me scheduled for a psychiatrist appointment, and then afterwards they had a built-in pharmacy, so I was literally able to pick up my meds, they had therapy. I just went from having like no services to having all of the services. And it's hard to say like how much that has changed my life. I've been able to get medical care, psychiatric care. It's enabled me to go to school, to work, and just made me feel like, I don't know, I have a support team. I really couldn't ask for anything more, if I'm being honest.
To see somebody go from deep addiction to sobriety and health is just, it's the most marvelous feeling in the world to watch somebody walk out with their head up. Because they walk in with their head down and they walk out looking at the sky. It's moving.